terrorists. When you realize the Minister of Health, as he said, fell off a bicycle and broke his wrist. And 2 in there in a comfortable bed in hospital. How many of you have relatives who've had to sit on a hospital chair for days with serious condition? The health minister bypassed the chair. Them can't go down in a hospital bed. And people still see them out a door and chair are dead.
The recent incident involving Health Minister Dr. Christopher Tufton, who received preferential treatment at the University Hospital of the West Indies following a minor cycling accident, has ignited a heated debate. The People's National Party, PNP, has suggested that Dr. Tufton was treated better because of his position. As much as I'm not a fan of the Jamaica Labour Party and disagree with many of their policies, let's be real, if Nikisha Burchell or any other PNP member were involved in the same incident, God forbid, they would have received the same preferential treatment as Dr. Tufton. In fact, being a woman, she might have received even better care. My close friends often say they can't tell which party I vote for because I strive to remain unbiased. I cannot agree with Burchell's criticism without acknowledging the broader issue. The reality is that government officials and other prominent individuals frequently receive superior medical care due to their status and connections. This isn't a problem unique to Jamaica, it's a global issue where those in power have better access to healthcare. Nikisha Burchell criticized the care Dr. Tufton received, contrasting it with the experience of ordinary Jamaicans who often wait for days in uncomfortable conditions for medical attention. She highlighted a crucial issue, the disparity in healthcare access between high-ranking officials and the average citizen. This disparity is not limited to the JLP, it is a systemic issue that would likely apply to any government official, regardless of their political affiliation. I agree that our healthcare system is in shambles. The fact that Dr. Tufton received prompt and comprehensive care while many Jamaicans suffer through long waits and inadequate conditions is a stark reminder of the inequities that need to be addressed. It's not about which party is in power, both the JLP and the PNP need to recognize and address the systemic issues within our healthcare system. This incident should serve as a wake-up call for all of us. It's time to push for significant improvements in our public health sector. We need to reduce wait times, improve hospital conditions, and ensure that every citizen, regardless of their status, has access to quality medical care. Let's use this situation as a catalyst for meaningful change. We deserve a healthcare system that treats all Jamaicans with the dignity and care they deserve. It's time for both parties to come together and work towards creating a more equitable healthcare system for everyone.